Mainly, I work therefore with the liver toxicity models, integrating therapeutic antibodies in the blood vessel model, so really focusing a little bit more on the tox side. Therefore, it's a lot about liquid assays, fluorescent-based assays, imaging. So I'm always happy or excited to have something new in the lab. I'm Anne-Katrin Bothe and I'm a scientist at Dynamic42. I'm the head of our liver and vasculature team as well as the head of our Dynamic42 Academy. I studied molecular and later on pharmaceutical biotechnology, and during my final thesis I dealt with the human immune responses to autoimmune antibodies as well as to pathogens like Candida albicans. After the studies I had the luck to jump directly into the job at Dynamic42 and now still dealing with immune responses more to therapeutic antibodies in the blood vessel model or to immune responses in our liver model. What inspired me to work with organ-on-chip technology? So during my studies I had to work with mice among others, and I realized quite quickly that it's not what I want to do in the future. So I was happy to find a good alternative like Dynamic42, which allows still working with compound screening but not to resort to simple 2D cell culture, and which provides a lot more opportunities than I thought at the beginning. How does organ-on-chip technology impact drug development? I think that organ-on-chip technology is a good step to reduce step by step the animal models, but we're still not at a point where we can replace it completely. Although there are a lot of advantages for organ-on-chip technology over the simple or normal 2D cell culture, at the moment we still can have a look at simple organ models or just single organ models. I mean, we're trying to connect them, build up interconnections, but we still try to break down the questions to a simple level. And when I see how many groups are working on this and what happened during the last years, I think also that in the future there are a lot of options and possibilities to further broaden this field, to interconnect even more models and to integrate also the whole immune system, not only a single component as we are doing at the moment, but having all the necessary steps to build up this human physiology. The most exciting project I'm currently working on is the further development of our liver-on-chip model, not to have it only for the human, but also for other species, like for example a rat liver-on-chip model. This would also enable us then to compare the data which we received from animal models, to compare this with the organ-on-chip technology from other species, and also then comparing this data better to the human physiology at the end. For customers, I mainly work on our standard models, the liver-on-chip and also the blood vessel-on-chip, but constantly I also try to develop these models, like having new cell types integrated, establishing new assays, or also developing the platform further, like building up new technical setups. Mainly, I work therefore with the liver toxicity models, integrating therapeutic antibodies in the blood vessel model, so really focusing a little bit more on the tox side. Therefore, it's a lot about liquid assays, fluorescent-based assays, imaging. So I'm always happy or excited to have something new in the lab. One misconception would be that there aren't as many readout possibilities for organ-on-chip technology as for standard 2D cell culture, but that's basically not true. So also for the organ-on-chip technology, with the supernatants you can do whatever supernatant-based assays you're used to. Also with regard to rescuing the tissue out of the chip, there's everything possible you also used to do with normal tissue culture.